compared with other states. But let me give you some examples of where we are in Alabama. Our diabetic population we're 49th in the nation. We don't have any legislation coming before us to address that. How about the infant mortality rate in Alabama? We are 49th in the nation. That's dead babies. Does anybody care? Is anything being done about it? I would say no. Nothing is being done about it. 49th in the nation in dead babies is what we are in the state overall. In the Black Belt of Alabama, where there's a dearth of health care, leads the nation in babies that are born dead. Premature death, 48th in the nation. Now, why do I bring these up? I'm going to check them off my list. I've got quite a few. It's really a terribly sad state of affairs. We spend our time working on vacation days for state agencies or speed limits or dedicating a highway name. We got people dying. We've got people sick. We don't seem to be addressing that at all. Now, I was talking with a physician, and that person essentially said that these issues are issues that are caused because of lack of self-discipline. But you know, how about the cardiovascular death rate? Is that the same? By the way, where are we in cardiovascular death rate? We're 48th in the nation. We have a serious problem. But let me tell you one thing, though. I know folks will be glad to hear. Where are we on annual salaries for physicians? I have some good news, at least for the physicians. We're 4th in the nation. However, those people that work hand in hand, those people that are in those hospitals 24 hours a day, in the clinic, taking your vital signs, counseling you, the registered nurses of Alabama, their salary levels are 49th in the nation. Well, what's going on? What's not right here? We've got a number of strange things. Oh, and what about the advanced practice nurses? In particular, those that we title as nurse practitioners. Some of the smartest, sharpest people I've ever met. Where do they fit in the appreciation order of what kind of salary do they draw compared with nurse practitioners in other states? They're 50th. These are highly trained people. And sometimes I feel like they're not only are they paid the worst in the nation, the worst, the lowest in the nation, they're not treated with respect. I've heard we've got a bill dealing with vaccination registry. Have you had your tetanus shot? Do you know when it was? What about your loved ones? You don't know. You probably don't know. I don't know. I don't remember when I got one. What a vaccination registry does is keep up with that information and made it accessible. So I heard a physician say, well, if we got to do that, I'll just quit giving them. I'm not going to do it. If you're going to make me write it down what I do, essentially what was said was, if you legislative body, you lawmakers, if you tell me how to run my practice and what to do with my patients, I'll just quit doing it. I'll take my ball, go home, leave you high and dry. So it's apparent that guidance from this legislative body is not welcome. However, I would like to contrast that with the fact that this same group is more than happy to tell other practitioners how to practice and what to do. There's discussion going on with podiatry right now downstairs. For whatever reason, I don't know, that was taken off the health care bill yesterday. The physical therapist been intervened by this group, these physicians. The physicians, in spite of the fact the Physical Therapy Board, Examiners Board, and Licensure Agency certainly know what these people are capable of, these physicians step in and essentially have exercised veto power. Same thing has happened with the optometry bill. Repeatedly, year after year, repeatedly. Suddenly the physicians have a better idea. They know more about what optometrists can and cannot do than an optometrist. The same is true of pharmacy. I sit over there listening to my seatmate, Senator Butler, talk about the frustrations that they have had in passing legislation that is absolutely and totally ignored by these physicians. Respiratory therapists. How about the radiation techs? They want to come forward and become licensed in Alabama, become regulated in Alabama, and they're being fought by the local physicians. In spite of the fact that excessive radiation is not a healthy thing. So all of these groups are being told what to do by this other group. I have a bill pending in the committee dealing with public health, where we have a small physician dues-paying group that selects and elects and controls and can fire a state agency head. This body right here, this legislative body, has absolutely no authority over this particular state agency. That same group of physicians controls another state agency. There's nothing like it in the United States, where you have a private group that is in control, full control of two state agencies, the Board of Medical Examiners. So basically, you got a small dues-paying club made up probably of a minority of the doctors that decide who's going to provide oversight for them. Now, here's one of the problems with that. Where do all these opioids come from that we have? Where are these drugs? Where do they come from that are on the street? Well, opioids are legal drugs. They have to be prescribed, however. Somebody's got to sign that prescription. My contention is the Board of Medical Examiners there's got to be a problem there, because not only do we provide more opioids per capita in our state than any other state. This has been going on for 7 straight years. We have led the nation in illegal drugs, or what started out as legal drugs. You do not get legal drugs on the street till somebody writes a prescription. And it's the people that control the authority to write that prescription that need to step in here. And as it turns out, they're selected entirely by a private group. It is a sad situation. I hope to see some of these bills come forward. Some of them come before this body. Give them a fair hearing. We let every other kind of bill come before this body. I've got 2 bills right now that are bottled up. We can't even have a floor debate on these issues till they come forward. And I'm telling you, this is part of the problem. This is why children's health care, I'll check this one off the list. in America, we are 38th. 38th. So with that being said, I'll turn this back over to the Rules Chairman, and I appreciate his patience, and I appreciate the Chair's patience in allowing me to voice this. I will say this, I've got more, and it's my intention to come forward and continue to work on educating our senators as to the what I consider the most deplorable and worst health care available in the country. Thank you, Mr. President.